All right, my name is Deshaun Little. We're going to be demonstrating a few of the exercises from week 4 for the I'm doing the Thomas test, the straight leg passive raise, and also some SMR for shoulder flexion and shoulder extension. It is 3. I just feel like that SMR exercise that I'm going to do can do help for both shoulder flexion and shoulder extension. I've been in one of you guys' lab sessions for Devin. I don't have a lot of time throughout my days. I'm trying to work my schedule to be able to join more lab sessions and be able to get in my hours and complete all I need to do for this PTA. Okay, so I'm going over these few exercises. Start off with this first one for the Thomas test. I don't have a table or a little bench, but I don't know how to set up my camera for that. So I'll just do it the way I seen from the floor, and using this foam roller here, just a little basic foam roller. So I'm gonna get set up, all right, in a supine position. Okay, so as I'm in a supine position, I'm gonna have that foam roller down, all right, where my lower back is, all right, in that lumbar area, that lumbo-pelvic area, mostly towards my pelvic region though, towards the hips, and not so much as on my back. All right, here, laying down, all right, and supine, have that foam roller there, okay, and I'm gonna start by doing this flexion, getting that knee flexion, hip flexion, bringing both knees in towards the chest. This way, it engages that lumbar, all right, flexion here, so I make sure my low back is pushing to the ground. I'm also getting that, posterior pelvic tilt there. Okay, so I'm starting off with my right leg. Getting that extension here. So hold on to my left knee here, keep that at a flex position. And what I'm going to do is, with our patients, is what you want to do is you want to get that full extension, try to get that full extension, all right, of that opposite leg. So that's the test leg here. So as I'm going out with that extension, I'm testing out, all right, that stretching and extensibility of those quad muscles, all right, tissues there. As you see, I'm going out. All right, and as you see I'm going out, you're going to watch out for that posterior pelvic tilt loss. So you don't want to make sure that they're not anteriorly coming up, that everything is staying straight as it's going down, checking in with the patient, making sure that, they feel a stretch as they go out, bring it back in, hold it for a few seconds, go back out, hold it for a few seconds, all right, with that full extension right there. All right, and as they're going out as well, you can't see it, but what I'm doing is I'm getting some dorsiflexion of the foot there, so I can be able to get a little stretch of the hamstrings and calves down there. I can be able to push that foot down, all right, push that foot all the way to the floor. You'll be able to see it a little bit, see that knee flexion coming in there. Push that foot into the floor, that way I can get a little bit of glute activation as well. So as I get that glute activation, making sure they still get a stretch of their quads there as they hold. All right, bringing it back in and completing those for a few reps. Also, as they're going out, you want to watch out for just a few things, making sure that leg stays in a straight position. So if it starts to abduct a little bit, you can tell there's some tightness here in those lateral muscles. All right, if they're starting to go away from the body, if they start to go inside the body, obviously there's the opposite there. Bringing it back in, asking them if they feel any pain, all right, throughout the region, and you're just checking for that extensibility and mobility of those hip flexor muscles. Then after a few reps, you'll switch over to the other leg. All right, might be a little tight after they've held it for quite a while. All right, to go on the opposite side, same thing. Get that dorsiflexion. You can see it a little bit there through the video, holding that position here. And every time as you're holding, when you come back in, that low back kind of caves in a little bit more. So you want to get that more posterior pelvic tilt. Even though I'm on this foam roller, even though it's harder, a little bit more challenging here, you still want to get that posterior pelvic tilt. So if they're flat surface, they're doing it from like a massage table or a bed or so, which most videos have shown, you're going to make sure they keep that low back engaged with the ground every time they go out. All right, and then bring it back in. So that's one of the key factors here, is that lumbar is engaging with the floor. All right, pulling back in. All right, going back out. Not getting any rotation of the hips. All right, not making sure that they don't overextend. It stays within the range of motion that we're supposed to be in for this test here, this assessment.